So I just discovered something pretty cool after listening to some Andrew Lock content. To give a little bit of background with my back injury, I'm in a constant state of discomfort regarding my hip flexors, my psoas, QL, all that stuff kind of related to the hip and core complex. I am in a constant state of uncomfortable in some fashion regarding those things. There's some days where it shifts from uncomfortable to pain. I wouldn't say I spend a whole lot of days, the whole day in pain. I would say I spend all day, every day in some sort of discomfort regarding that. But some days it kind of creeps into that pain realm. And this morning was just one of those days where it was just in that pain realm, in this annoying, nagging pain realm, and I couldn't get my QL to quiet the fuck up. And I have been, I've always watched a lot of stuff on Andrew Lock. He's one of my favorite people to listen to in regards to strength, recovery, rehab, activation, all that stuff. But one of my problems is I listen, but I don't hear it. You know what I mean? Like I listen to it. It all sounds cool, but I don't hear it. It doesn't like stick with me. For whatever reason, listening to Andrew Lock on the Elite FTS Table Talk podcast, he was talking about agonist, antagonist muscles. If one muscle is tight, overacting, painful, the answer isn't to attack that particular muscle or that particular area. You find the antagonist muscle, the opposite muscle, and you strengthen that, or give yourself some exercises or some routines to activate that area. And in the Table Talk podcast, he specifically mentions the psoas, and he says if someone has a tight or angry psoas, I never stretch a psoas. I give them specific exercises to turn on their glutes, which would be the antagonist muscle to the psoas agonist. And I was like, okay, that makes sense. I have constant issues with my psoas, my QL, and stuff like that, and I'm always doing stuff to it, always doing stuff to try to strengthen it or stretch it. And it's not that I don't do things to strengthen and stretch my glutes. It's just there's just such an overwhelming focus on just strengthening my hip flexor psoas area, because I was approaching as they were weak, and glute work was done, but the ratio was way off. Like daily doing things for my hip flexor psoas, and just basically kind of like my lower days attacking my glutes. So I decided that I was going to cut off a lot of the stuff I was doing for the hip flexors, and I was going to start focusing more on kind of balancing the glute work. And that well, to be honest, I guess I was only 3 days into it and not really seeing much of a change, which I wouldn't expect to see immediate change. But I was watching one of Andrew's videos this morning about the Clam Lock, which is just his version of a clam, which is a glute exercise. And I did that one specifically, and my QL psoas kind of off to the side, like the TFL, all that stuff shut off like almost immediately. Like after the first set of doing the clam locks, that stuff just kind of like shut off almost immediately. And I was like, this stuff doesn't happen to me. Never ever have I been giving something to do to alleviate something, and it was like an immediate shut off. And to me, it's too good to be true. I'm not making this video to say that this fixed me. I'm just making this video so I just make it for the sake of kind of like documenting for myself what I did to get rid of this. And if anybody else is having any similar problems, to research it themselves, but also watch Andrew Locke stuff on lower back and hip flexors and glutes. But yeah, I did it, and it was just like almost an immediate shut off, and it like traveled downstream too, like because of what I have going on in my midsection. My knees and my ankles are always in a constant state of pain or discomfort or tendonitis or just something. And even that, like a lot of my knee pain and ankle pain almost shut off too. It's weird for me to think doing something as simple as like 2 or 3 sets of 15 to 20 on a glute exercise, turned off, the months and months and almost years of constant tension. It's making me hopeful. I'm definitely going to keep doing it, but the purpose of this video was just more or less for me to document it for myself and be like, okay, you did this and it worked, and not so much as this is going to stop your pain immediately, just because it was like an immediate fix for me. I don't anticipate it to be that way the rest of the day. I don't anticipate it to be like that tomorrow, but I'm going to keep doing the clam locks a couple times a day. And after about a week or so, a couple weeks, see where that puts me. But yeah, I just had to make some sort of record of that because that was really cool.